Good afternoon, everyone, and thank you for coming along to the Digital Health Self-Assessment information session. We're here to talk about the digital health self-assessment that's currently open to all general practices and allied health practices. And it's all about us better understanding the digital health status and the needs of your allied health practices and general practices across Western Victoria. I'll begin by acknowledging the traditional owners of the lands. Today I'm on Wadawurrung country, and I'd like to pay respects to elders past and present, and extend that respect to any Aboriginal or Torres Strait Islander people either with us today or watching this recording, and I'll pay respect to whatever lands you're on as well. So I'm Sarah Crowe. I'm the Digital Health Manager at West Vic Primary Health Network. And as mentioned, at the moment, we've got a survey, I guess, that's open to all allied health practices and general practices. And there's a few, and we're asking lots of questions about digital health, and there's a few reasons why we're doing that. The first one is before we go making plans over the next couple of years, we'll want to avoid making assumptions about what's happening in allied health. We want to make sure we ask the right questions to get the information from you so that then we can develop a digital health strategy that includes how we can support allied health in the digital health space. We want to make sure that we are targeting our resources and our education and our support in the right way that meets the needs identified by your responses. And we want to make sure we're collecting that information directly from you. There's also the ability for us to advocate on behalf of allied health and general practice to peak bodies and influencing organisations. This might be the department, it might be the Australian Digital Health Agency, it might potentially be software companies. But if we can get information from you about how digital health is currently working or not working for you, then we can certainly look at advocating in the right way and providing the right resources and support. So what's in it for your practice? Why should you complete this with us? The first thing to point out is that you will get a personalised individual digital health action plan for your practice. So based on your responses, we'll then provide you, within about a week or so, we'll provide you with an action plan that directly responds to what you've told us and has suggested training. It will tell you which staff in your practice perhaps should look at doing that. So that's ticket number one. That's the first reason you should do it. The next part is to make sure that we at Westvic PHN don't just blindly go providing resources or education without understanding why we're doing it. So it's about making sure we target our support as per the results we get from you. It's also a great chance for your practice to have their say and be included in what we know about digital health in Western Victoria. And it will help us guide future education and any support and resources that come up in the future in the digital health space, and make sure that our future planned activities meet the needs identified by your practice. Before I hand over, I'm just going to say, if at any point you have any questions, if you'd like support, if you'd like someone to come and visit you and sit down and do that survey with you, or we could be on the phone, or we could have a virtual meeting like this to support you. Or if you've got any questions, you're not sure how it works or who should fill it out in your practice, please contact either our primary care engagement team or digital health. So you can contact us at digitalhealth@westvicphn.com.au. Now I'm going to introduce you to Elise from Semantic Consulting. Semantic Consulting is the company, the consultants that we have commissioned to help us run this project and collect all the information. It's their product that we're using. And so I'm very pleased to introduce Elise.
Wonderful. Thank you, Sarah. And just would like to acknowledge that I'm currently on the beautiful lands of Bunurong country, which is down in Phillip Island, Inverloch, in southern Victoria. So as Sarah said, my name is Elise, Human Manager at Semantic Consulting, and I had a lot of fun in the last few probably months and weeks leading into launching the digital health assessment for both general practice and allied health. Now, obviously, we're here today to discuss allied health and what is in it for allied health providers across the region. Now, Sarah and the team have disseminated probably quite broadly and widely a link to complete the assessment. Now, if you can't access the link, if you can't find the link, please feel free to reach out to the digital health team. Sarah, the contact details were on the previous slide. They can send you the link to complete the survey. Now, when we've been working in developing the assessment questions, we've worked really hard to ensure that it's not only user-friendly, but it's also been designed to be completed so that you don't have to jump off your desk and find the answers. They're questions where there's ranges and approximate responses that we're seeking. So you should be able to complete it in one session if you don't get interrupted without having to jump off and look for different information across the assessment. It has been designed with you in mind, knowing that you are very busy. So we're estimating it's going to take allied health professions probably between the 20 to 25-minute mark to complete. We have run this assessment across other regions across the country, and we deliberately aim for that ballpark time. We do ask that it is just one assessment to be completed per practice. Now, we understand allied health practices are multidisciplined. We ask you questions about that within your practice. So have a think about who is best placed to answer on behalf of your practice. What we do commonly find, it possibly could be the practice owner, it could be the practice manager if you have one, or it also could be a lead allied health professional that has a vision across all the different allied health providers within your practice. If you are unsure who should be best placed to complete it, or if your practice has completed it, if someone else has picked up the link, again, please feel free to reach out to the digital health team. Sorry to put you on the spot there, Sarah, but I'm sure the team are more than willing to help get these response rates. What I'm going to do now is just share my screen and give you a little bit of a feel of what the assessment looks like. So just bear with me while I share my screen. So when you click the link, you'll be taken to this landing page. Obviously, digital health self-assessment for allied health. Across the top here is a bit of a path on the different sections that we're exploring within the assessment. So you can see that there are 16 sections. A lot of some questions fall under each of those questions. So at the front of the assessment, you will just have a brief introduction. So probably recapping a lot of what Sarah and I have already spoken about, just reiterating that, we do allow 25, probably 30 minutes, being generous to complete the assessment, and also noting that the assessment cannot be saved and returned to at a later date. If you do get interrupted or the phone calls or someone knocks at the door, someone walks into reception, if you leave your browser open, you can come back to complete the assessment. We have your name here. Now, obviously, because I've clicked on the link, my name is auto-populated, but please feel free to insert your own name. The date will be auto-populated as well. And also, we just ask for your email address so that the team can send you those individualised action plans at the completion of the assessment. And also, just asking for your practice name. So the practice name in which the patients know your practice by. And just again, really reiterating, it is just one response per practice. If by any means we do receive a couple of responses across the same organisations, we'll be able to pick that up and work with the team at Western Victoria rather. We ask you to select the region in which you're in across Western Victoria, and we also have some consent information here as well. So just wanting to assure you that we at Semantic Consulting, we have got a privacy policy relating to the platform in which we collect and analyse the data. And there's also a link here for the Western Victoria privacy statement as well, if you do wish to review that. Obviously, the data collected as a part of this assessment will not be shared with any external parties or government departments as well. So your data is safe and secure with us. Um, if you are willing to continue on with the assessment, we just click yes. If by some means you don't want to do it, we just click no. That's the end of the assessment for you. But hopefully we're going to click yes, and then we're going to click the next button. So, as I said, we've designed this assessment to be very, very user friendly. So we're all you can see we're up to section number 2, practice information. We're just wanting to get a bit of a sense of what your practice looks like. So what's your role? So you could be the practice manager, an allied health clinician, or the practice owner, or other. For the sake of this, I'm going to say I'm a practice manager. And we're also asking which allied health professions do you support as well. So you could provide OT, you could provide physio, you could provide podiatry, select which one suits you best, how many years have you been in operation. I'm going to say I'm a private group. I have my own private premises, 2 to 5 allied health professions. So as you can see, we have designed the assessment with you in mind. We've hopefully made it really user friendly to complete, and that's the first section completed. Sarah, before I stop sharing my screen, is there anything else you would like me to go over?
Think that's probably enough for today. I think you get the idea of how easy it is to fill out and the style of the question asking.
Yeah.
That it is sort of giving you multiple choice options or ranges. But as we've said, you're very welcome to reach out to the digital health team if you want some support or have questions. We are very excited to be offering this to allied health this year. We've done it with general practice in the past. But we're recognising the need to engage better with our allied health professionals. And we have heard across the grapevine that there is a really great appetite for digital health technologies and programs in the allied health space. So we want to get that information from you so that we can look at providing support and resources in the future. So I think that's it. Thank you so much for either coming along or watching. And we look forward to receiving your responses.